between each other due to CSF circulation. The CSF circulation starts at the lateral ventricle, then it will pass to the third ventricle through the interventricular foramen of Monroe. As you see here, the connection. We have two interventricular foramen and one third ventricle. So the CSF may be produced in the lateral ventricle, and it will pass to the third ventricle, and from the third ventricle it will pass to the fourth. Regarding the ventricular system, the cavity of the cerebral hemisphere is the lateral ventricle. This is the anterior horn of the lateral ventricle, posterior horn of the lateral ventricle, and the inferior horn of the lateral ventricle. The cavity of the diencephalon is third ventricle. This is the third ventricle. Here we can see. This is the cavity of the diencephalon, third ventricle. The pons and the medulla oblongata share a cavity of the fourth ventricle. The choroid plexus, you see here this choroid plexus, also in this specimen, choroid plexus of the lateral ventricle are the large and highly vascular, which is creating the bulk of the CSF. The choroid plexus of the lateral ventricle is continuous through the foramen of the Monroe with that of the third ventricle, while the plexus of the fourth ventricle is separate from that in the lateral and third ventricle, which is only make a small contribution to the total amount of the CSF. Below the fourth ventricle, the central canal extends to the through the spinal cord into the phylum terminally. The lateral ventricle is a C-shaped structure. This is the cavity of the lateral ventricle. C-shaped structure consisting of the body and projecting forward through the frontal lobe into anterior horn, and these parts are floored by the caudate nucleus and the thalamus. This is the thalamus here. Also, these parts are floored by the roof, by scopus callosum and the cortex. The anterior horn, as you see, this is the anterior horn of the lateral ventricle, is bounded by the genu of the corpus callosum. So that the roof of this ventricle is, anterior horn of the lateral ventricle is the genu of the corpus callosum. And forceps minor, here we can see this is the forceps minor, which is that part of the of white matter that originating from the genu to the frontal bone. The floor is the bulbous part of the head of the caudate nucleus. Here, this is the caudate nucleus, head of the caudate nucleus, which meeting at the roof at an angle on the lateral side, but it's separated from the roof medially by septum pellucidum. This is the septum pellucidum. This part is called septum pellucidum. The body of the lateral ventricle is floored by thalamus and body of the caudate nucleus. Body of the caudate nucleus and the thalamus. with thalamus striated group between these two structures, which is note the thalamus striated vein. The roof is the body of the corpus callosum. The roof is the body of the corpus callosum. Here, the corpus callosum were removed here, was removed from this specimen. And also the crust and body of the fornix. From the body, the cavity here, the cavity of the lateral ventricle arch downward and then forward into temporal lobe. Here, into the temporal lobe to form the inferior horn, and backward here to form the posterior horn of the lateral ventricle. The medial wall of the posterior horn of the lateral ventricle, consisting of the slightly two convex structures, which is not here clearly observed, include both one is produced by the collateral sulcus and another formed by the calcarine sulcus. The upper is called bulb of the posterior horn, which is produced by forceps major, and the lower one is calcarine, formed by the calcarine sulcus. This is the calcarine sulcus here, you can see from the posterior part of the corpus callosum, below the splenium of the corpus callosum, toward the occipital wall here. This is the calcarine sulcus. The roof on the lateral wall is formed by the tapetum and optic radiation, which is part of the medullary center. The inferior horn is the largest, and it is floored medially by structures. Here you can see, this is the inferior horn, occupied by the hippocampus, and laterally by a collateral eminence, which is expanded posterior part of the collateral triangle. The roof and the tail of the caudate nucleus continuous anteriorly with the amygdala, which is not cannot be seen here, and the laterally is closed by the tapetum. The third ventricle, here we can see the third ventricle. This is the third ventricle between two thalami, which is a cavity of the diencephalon, which is continuous with the lateral ventricle through interventricular foramen of the Monroe, and with the fourth ventricle through the cerebral aqueduct of Sylvius. The posterior wall is formed by the pineal gland, posterior wall of the third ventricle formed by the pineal gland and habenular and posterior commissure. Here we can see this is the fornix and this is the corpus callosum. The structure involving in the posterior wall, which is formed by the posterior commissure here and habenular commissure, and between it there is a pineal gland. The lateral wall, here we can see formed mainly by thalamus. This is the thalamus, and also superiorly and hypothalamus inferiorly. This is the hypothalamus and this is the thalamus. Separated by hypothalamic sulcus. This is the hypothalamic sulcus. Are joined together by interthalamic adhesion. The two thalami interconnected by the interthalamic adhesion. This is the interthalamic adhesion. The hypothalamic sulcus curved from the interventricular foramen of the Monroe here to the below the thalamus to the cerebral aqueduct of Sylvius. Here we can see this is the part of the cerebral aqueduct of the Sylvius. This is the anterior interventricular foramen of the Monroe, and here, and this is the cerebral aqueduct of the Sylvius. The fourth ventricle is a tank-like structure anterior to the cerebellum and posterior to the pons and the medulla oblongata, continuous anteriorly with the central canal of the spinal cord and superiorly with the cerebral aqueduct of the Sylvius. The floor of the fourth ventricle is rhomboid fossa. Here the rhomboid fossa, a diamond in shape, formed by the posterior surface of the pons and cranial half of the medulla oblongata. It is divided into a symmetrical half by a median sulcus. This is the median sulcus here. And on each side of this sulcus there is a medial eminence on both sides of the median sulcus, bounded laterally by a sulcus called sulcus limitans. Here, lateral part is of the medial eminence is the sulcus limitans. Also, we can see in this rhomboid fossa, in the floor of it, there is a two triangle here in the inferior surface called vagal triangle and the hypoglossal triangle. Vagal triangle and the hypoglossal triangle. In addition to that, the boundaries of the rhomboid fossa, as you see here, is formed by the superiorly or the roof by the superior cerebellar peduncle and superior medullary villum here, and in the lower part of the medial eminence there is a two swelling-like structures. It's called facial colliculus. Facial colliculus is formed by the looping of the facial nerve around the abducent nucleus. In addition to these parts described, there is another part here in this section. You can see in the midbrain there is a four colliculi, superior colliculus and the inferior colliculus. The superior colliculus, here we can see the superior brachium that end into the lateral geniculate body, while that of the inferior colliculus, we have the inferior brachium that end into the medial geniculate body. The lateral geniculate body concerning with visual activity, while that of the medial geniculate body is concerning with the auditory function. Here we can see also this is the cerebellar peduncle. This is the middle one, which is the largest one, and this is the superior one, and here the inferior cerebellar peduncle. Also another specimen here, we can illustrating the presence of the posterior horn here of the lateral ventricle. The part that's formed by the bulb and the calcar abis. This is the calcar abis and this is the valve, which is on the floor of the posterior horn of the lateral ventricle.